Hey future nurse, why don't you pause the screen and let me know if you can answer this NCLEX question of the day. Now, if you've unpaused your screen, I'm going to show the correct answer, which is option B. Now let's dive in as to why. So the nurse is caring for a female client with a diagnosis of terminal cancer. Due to the side effects, the client wishes to stop chemotherapy. Which of the following actions by the nurse is most appropriate? So option B is the correct answer because even if the nurse agrees with it or not, they need to provide the client with education, the risks and the benefits of stopping chemotherapy so that that client can make an informed decision on whether or not they want to continue with therapy. Now let's dive into the other options and see why they're wrong. So option A, the nurse should encourage the client to continue chemotherapy because the treatment can prolong her life and improve her quality of life. Now this represents beneficence and non-maleficence. We want to do good and avoid harm. But these principles should never overpower the client's right to make a decision. Option C, the nurse should advise the client she needs to seek advice from her loved ones. Now this is kind of going away from what is the most appropriate action, which is provide the client with facts. Tell them about the risks, tell them about the complications, tell them about the benefits, and then they can make the decision if they want to speak with their loved ones. But we aren't going to immediately deter the conversation to you shouldn't get the opinion of what your loved ones think. Because at the end of the day, autonomy trumps all of this and the client is able to make their own healthcare decisions. And option D, the nurse should encourage the client to continue chemotherapy because there are interventions to alleviate the side effects. Once again, this is not respecting a client's autonomy because you're encouraging them to continue the chemotherapy. Even though we do have some education here where we educate them on interventions we can provide to alleviate side effects, you still shouldn't encourage. You need to stay neutral whether you agree or disagree with the client. Alright, future nurse, I hope you have learned something today. This is how we incorporate the ethical principles into these NCLEX style questions. Don't forget to like, comment, and follow. I am also on Instagram and YouTube at NurseJess1620.